I'm standing in for Ed Rosen, who started the project called the Lambeth GP Food Co-op, which is actually quite a groundbreaking project, and it has a much wider and broader context than just growing food. And I just want to give you a very quick, I'll try and do it as fast as I can, because what I'm going to do is play a 5-minute video which really is self-explanatory about what that project is about and its value to the local community in Lambeth. Quick bit of potted history about myself. I'm now an artist, and from next week I shall be showing work in this room. But I also have a background in patient engagement, public and patient engagement and health, going back 20 years. If anybody knows about the One List report, which Gordon Brown commissioned in the early 2000s, that was really about looking at how we can change the way the system operates so that we focus on the third of the population who are managing long-term health conditions. Staggering, it's a third of the population. And those are the people that are rolling into GP surgeries and need them most. And my interest has come from, so about, 28 years ago I started one of the first digital media companies. So that's even before the internet. And I got roped into social projects, particularly working with health education and with the Department of Health, with the Expert Patients Program, with things like patient activation, PALS, you name it. I did the campaigns to sort of try to get them promoted and integrated into the system. And it is a hard battle to get patient engagement into the NHS. It's really, really challenging, because it doesn't matter how many words are spoken and how much jargon is produced and reproduced and how many times we rewrite the plan, it still feels like we're going backwards. And I had a digital media company that was really working with this quite successfully up until 2010, when we had austerity and Cameron Osborne came in and they just wiped all our contracts overnight. And so what we did was, rather than try to rebuild that business, which was really about national messaging, my interest is in the message, the way we communicate, the way we think about health and medicalization and the system of who we, all of us, think we are when we're a patient, and who we, all of us, think we are when we're a medical professional as well. Because really it's about language. So we can rewrite the plan as many times as we want. If we get the language wrong, nobody understands. They will still rock up and they will still sit in a waiting room, and we will still support what I describe as the sit down and wait culture. So how do we think about design to sort of change that, to alter that perspective in people's minds, in communities? And this project is really exciting. It's not just about growing food. It's about who these people who have come out of their homes, most of them don't have gardens, and who they think they are in their relationship with their GPs. So if you could watch this with that in your mind, I think it will raise a lot of questions.
Patients, doctors, nurses, and Lambeth residents who grow food together. We work in partnership with GPs across the borough, building gardens in GP surgeries and developing unused spaces for food growing purposes. We have built 11 food growing gardens in GP surgeries where patients are actively involved in growing food together, including a garden in King's College Hospital, where we have a monthly stall selling patient-grown food. We were awarded the Best Sustainable Food Initiative in the NHS by Public Health England and the NHS Sustainability Unit.
It got started from a conversation with GPs, patients and nurses located in Lambeth, who were interested in whether we could create a network of food-grown gardens across general practice in Lambeth. We were fortunate enough to attract support from Lambeth Council. We also have a very forward-looking and visionary clinical commissioning group in Lambeth, who also funded us to get the Lambeth GP Food Co-op up and running. We have a community across the borough who are involved in different activities interlinked around food, diet and nutrition. The aim of this project is to influence food procurement. It's one of the aims in the NHS. We have 60 hospitals in the M25 corridor. Not one of them buys anything grown locally. We're looking at this one as having an economic context as well as a therapeutic context.
Being part of the food co-op is part of a much bigger ambition that we have, which is really trying to melt away the walls of the surgery and become a much more open building or place for the community where they can come and have access to health and well-being.
The kind of patients that I recommend coming to go are people who may be a little bit isolated, maybe have depression, low mood, other mental health problems that make it difficult for them to get out.
Those with long-term conditions or who are socially isolated, or anybody actually who's interested in keeping fit in another way and meeting other people in the group.
My name is Lil Sullivan. I'm an artist and a singer-songwriter and a stroke survivor. I heard about it in the doctor's surgery. It's nice to go to Brixton and see all the different people. I'd like to do the portraits of all of them. They're so interesting.
I like gardening. I like to be on soil sometimes doing things. Like to get my hand dirty.
I like garden groups, leaf people, and they're very friendly and easygoing, and there's no pressure.
We're bringing back some of the key values of the NHS back into this garden, and those values are around mutuality, support,
which promotes health and well-being rather than just having it all in my room.
So I hope you could hear that and got the gist of it anyway. I was a board member of the Lambeth GP Food Co-op, and so I know a bit about it if you've got questions, but just as a postscript, after my business was obliterated in 2010, we started a company called Know Your Own Health, which really focused on the language and the communications with patients, but really it became about enabling and empowering people to voice what matters to them, particularly people with long-term health conditions. So what matters to them in relation to their care from their GP surgery and from the NHS. Because it doesn't matter whether or not it's, you can work with diet, you can work with fitness, you can work with all sorts of things, but really the key change agent is really when people begin to recognise what barriers they've got, what their personal barriers are, and what their opportunities are to shift the dynamic in their relationship with the health service. Because otherwise they just remain passive recipients. And in design, when we think about building design, what do we want people to do? Do we want them to come in and sit down and wait, or do we want them to engage? And one of the projects that we did was here in Lewes. We worked with all the GP surgeries here in Lewes and in Peacehaven and Newhaven. It was about 4 or 5 years ago, for a couple of years, and we supported people with long-term health conditions alongside the work that the GP practice did, and we produced data. Well-being, we had a little conversation earlier as to whether or not well-being and prevention is measurable. Well, well-being really, or prevention really probably isn't particularly measurable, but the amount of times that people go along to the surgery is measurable, and the amount of sort of engagement that they have is measurable. And we carried out some research here in Lewes, which 4 years on is about to be published by Imperial College. I'm not sure that the GP surgeries know that that's the case, but it's been a very successful project, and it has informed NHS England's funding decisions around health coaching and well-being and social prescribing. So some of that work actually happened here in Lewis, which is very exciting. And so therefore it's really exciting to see what's happening with the Foundry. I'm no longer directly involved, but I can provide signposts to information if people want it. Thank you.
Let me ask you a question, because something that struck me that you said, which Helmut said about people taking responsibility of their own care. Are you saying something quite similar?
Oh, absolutely.
Is that something that actually could be a banner around which more things can rally?
Well, the thing I feel like is when you walk through the surgery, through the door of the front door of the surgery, the question that always comes to my mind is, who do I think I am? Am I a passive recipient of this care? Am I going to just go and sit down and wait for my 10-minute? Or am I going to think about what matters to me? And of course, that's not a conversation that a GP can have very easily. But in culture change, in behaviour change, if we as a species opened up to the possibility that we can take responsibility.
But some of us have more agency, some of us have more sense of agency. You are able to think that way. How does the system enable you to remove those barriers?
It's somewhat political, isn't it? Because in a way, we had the Oneness report, and we should have had all sorts of good things happening from that, and we did. But of course, we've gone back, and particularly in this current climate that we're in. I mean, I'm quite sort of cynical now because I'm tired and older. But the point is, what are we dealing with? Are we dealing with, is the NHS, is the health industry, is it about wellness, or is it an illness business? And when you strip everything away at the moment, it's very much an illness business. And of course, the farm companies may have great projects.
There's business in illness.
So that's really the question.
Absolutely. Thank you very much. And we'll